Coming on the heels of a global pandemic in 2020, Community Cancer Fund was determined to bounce back in 2021 and continue to provide levels of support to the local community seen in previous years. We were able to bounce back in a big way. Last summer's showcase was our most successful event ever. Thanks to your generous support at last year's event, Community Cancer Fund has given over $150,000 to pediatric cancer support and special needs for patients and families through the work of Aquiline and Providence Sacred Heart Children's Hospital. We have donated $10,000 to help facilitate over 80 patients in the Live Strong program at the YMCA. We have invested $60,000 and provided over 610 room nights of complimentary lodging through our unique collaboration with Davenport Hotels. We donated $115,000 from our camp endowment to fully fund this year's Camp Good Times at Camp Reed for children and families, the first in-camp experience since 2019.
So exciting to be back at camp with kids, and this year we're having family camp. It's just nice because when cancer affects a child, it affects the whole family.
We haven't been able to do a lot all together in a long time, so it's just fun to be making memories with all of them, and also just for the kids to get to kind of see the community that we've all seen. The younger kids get to kind of see that community and be able to just make memories together.
And just 2 weeks ago, we were able to put a bow on our most recent project, our $5 million gift to Kootenai Health, by honoring the extraordinary generosity of Tom and Debbie Davidson. Open since 2019, we officially unveiled the newly named Davidson Family Hospitality Center.
It's a scary time when you have cancer. And I walked through that door and it was like, I'm not afraid. I'm home in a safe place. It isn't just a place to stay. It's part of the healing process and part of the treatment process.
It's just so needed and so well done that it feels wonderful to be a part of it.
With this in mind, we shift our focus to the recently opened Ronald McDonald House in Spokane and our lead gift of their capital campaign, a $3 million commitment to help pediatric patients and families when they need it most.
With a brand new house, we have increased our capacity by 61%, which means we now have the ability to serve a total of 56 families. That is more than doubled what we used to have. Our folks don't have to say no. They don't have to say, you'll have to wait. So this is a blessing for the whole community and for our regional folks as well, as most of these rooms serve those from outside of our community that have nowhere else to go.
Additionally, Community Cancer Fund has been working with our local partners to identify ways to increase cancer research conducted in our region. And thanks to a relationship between Ryan Gee and his alma mater, University of Notre Dame, we are able to bring the world-renowned Harper Cancer Research Institute together with our local partners on a unique research collaboration to study local tumor samples of underserved populations, particularly Native American populations.
Cancer touches everybody. We've all known some of this past from cancer. We know a lot of people that have cancer.
Cancer is extraordinarily complicated. It's not one disease, it's a family of diseases. We really need to bring in everybody from all different disciplines to address this problem. We are very interested in working with other communities nationwide and even worldwide to give the opportunity for people that are not usually represented in cancer research to participate in some potentially life-saving work.
When the Community Cancer Fund brought us this opportunity to participate in this project, we jumped at it. Native Americans have been underrepresented in clinical research.
In the largest database of cancer-driving mutations that's available, there are 85,000 cancers represented. Of those, 113 are from Native Americans. That's less than 1% of the data that's out there.
If we have underrepresented populations in clinical research, those cancer treatments are not going to be as effective for that population. We need to bring underrepresented populations into our clinical research.
A portion of the population's been kind of forgotten about, ignored, and there's research that needs to be done. So it's great to see that people are taking an interest.
The samples that we're using as part of this project are samples that are already in existence.
With MultiCare's help, we're ready to start analysis on the first samples right away. And by the time we meet again next year, we hope to have doubled that number in the national database. Because of our conversations with Ryan and the Community Cancer Fund, it got us thinking, why stop in the Northwest? Why not look locally? And we've begun conversations with the Potawatomi tribe here. Eventually, one with the Kalispel will become two with the Potawatomi, and hopefully we can move forward and really tackle this disparity in the Native American population nationwide.
In addition to bringing the parties together needed for this collaboration, we have committed over $300,000 in both CCF and private party funds to make this project a reality. In our continued work with our regional medical partners at Kootenai Health, Cancer Care Northwest, Providence, and MultiCare, along with Spokane-based medical schools, we look forward to continuing our push, our challenge, and our aspirations to create a best-in-class experience for all cancer patients traveling to our region for cancer treatment and care. This can be accomplished through a focus on much-needed clinical research trials, improving our local residency programs, and other day-to-day needs of patients currently not being met. Community Cancer Fund is positioned to continue making a difference for those patients and families that need our help most. It takes an organization driven to provide better. It takes unique collaborations with exceptional partners. It takes caring individuals, and it takes a community.